Let's begin with the fourth section, which is also the last section of our lecture, head and neck cancer. In this section, we will discuss the different treatment options for the head and neck cancer, and concomitant chemo radiotherapy is the one option or treatment method. Then we will talk about some complications of the cancer and the treatment, and also salivary gland tumors. So the treatment is localized disease. Mainly the treatment which is picked and choose for treating the cancer, different options depend on the stage of the cancer and also depending on the differentiation of the cells. So if these early stage cancer is diagnosed, the treatment is more based on the localized treatment and to remove or limit the spread of the cancer to the different site. But if it's already spread, widespread, it's late stage cancer, then usually the treatment is more or less palliative type of treatment, symptomatic treatment to relieve the different problems patient might have and to try to make the life of the patient comfortable as much as possible. So treatment of the localized disease is surgery, small lesion in oral cavity. If it is present, then usually the first choice is to go for surgery and reduce or remove that local lesion and swelling. Radiation therapy, if it's a laryngeal cancer, radiotherapy. Choice varies, differs based upon location and the expertise of the individual. So for laryngeal cancer, we do the radiation therapy. For small oral cancer, surgery, and again the choice depend on the location of the tumor or cancer or the expertise of the individual who is performing the procedure. Locally or regionally advanced disease, curative intent, combined modality therapy in which we have surgery, radiation therapy, and induction chemotherapy. Induction chemotherapy is by the 3-drug regime, which include 3 chemotherapeutic drugs. We have cisplatin, fluorouracil, and docetaxel. So these are the 3 chemotherapeutics used for induction chemotherapy. Before surgery and radiation therapy, this is used. Sequential multimodality therapy. Then we have concomitant chemotherapy, which includes simultaneous chemo and radiation therapy. Tumor recurrences develop, and also there is enhancement of tumor cell killing. So these are few different treatment options. We have surgery, radiation therapy, induction chemotherapy to induce the drug, beginning of the chemotherapy, which is usually by the 3 drugs, and then we have concomitant therapy along with the radiation therapy, and there are tumor recurrences develop also. Concomitant chemo radiotherapy, together both the chemotherapy and the radiation therapy is done for bulky tumors and if the increased toxicity. So both chemotherapy and radiation therapy is used for the tumor which are bulky and they have increased toxic level. Produce better laryngectomy free survival. So with the concomitant therapy, the survival is improved, so they don't need to perform laryngectomy or removal of the larynx, and just this concomitant therapy helps in improving the survival rate. Radiotherapy with cisplatin is used. Monoclonal antibody to EGFR, which is the cetuximab is used, and milder systemic side effects. So these have milder systemic side effects. They do not have as severe side effects as some other chemotherapeutic drugs. So concomitant chemo, radiotherapy, combination of chemotherapy and radiotherapy is used to increase the survival time without laryngectomy, and usually cisplatin is used, and there is another antibody with the name of cetuximab that can be used, and they have minor systemic side effects. Treatment for recurrent or metastatic disease is with the palliative intent. So once the disease or the cancer spread or metastasized to distant sites, as I mentioned, the aim is then the palliative treatment to improve the survival of the patient, and then usually to relieve the symptoms which are affecting the patient. So mainly it's with intent is do the palliative treatment if it's distant metastasis or if it's keep on occurring again and again. Local or regional radiotherapy, mainly chemotherapy, EGFR directed therapies, tyrosine kinase inhibitors, and also cisplatin, carboplatin with 5-fluorouracil, paclitaxel or docetaxel. These are some chemotherapeutic drugs that can be used for the recurrent or metastatic disease, but the intent is main palliative therapy, not the very severe aggressive therapy. So it's the main intent is the palliation, not the cure. Complications are there is mucositis and dysphagia, difficulty in swallowing and mucositis, xerostomia and loss of taste, dry mouth. The xerostomia is dry mouth and there is no secretion of the saliva, and when that is present, usually the taste is affected. Person cannot taste the food very good. There is decreased tongue mobility, malignancies, neck fibrosis, myelosuppression or suppression of the bone marrow. Myelo is for bone marrow suppression, nausea and vomiting, and nephrotoxicity. So all these are the complications which are due to the metastasis of the tumor to the distant sites. If they affect the kidneys, there is nephrotoxicity, there is nausea, vomiting, bone marrow suppression if it spreads to the bone, and there is malignancies, neck fibrosis. All these can occur. There is dysphagia also present. These are all the complications that can occur and they can affect the person. Salivary gland tumors is benign, treated with excision. We already mentioned that mostly salivary gland tumors very commonly affect the major salivary gland, which is the parotid gland, and these are usually the benign tumors. They are excised. Invasive radiotherapy and surgery. So if the tumors are invasive, the surgery and radiation therapy is used. Local recurrence is common with salivary gland tumors. recurrence of adenoid cystic carcinoma, chemotherapy with cisplatin or doxorubicin. So if there is recurrence of adenoid cystic carcinoma, treated with the cisplatin or doxorubicin. So this was all about the section 4 of our lecture. Thank you for watching sqadia.com.